It is quite troubling. It is spreading like flu, and it also is a higher death rate compared to flu-like illness. Flu has a death rate of somewhere between 0.1 to 0.01%. It means 1 in 1,000 to 1 in 10,000 people who would acquire the infection will die. But coronavirus has a much higher death rate at present. So if you just only look at China, I think they've had close to 90,000 cases, and I think over 3,000 people died. So that puts the incidence somewhere between 3 and 4%. But outside of China, the death rate hasn't been that high, and I think we're still not able to account for all the patients who have had coronavirus. So I think eventually, when all said and done, I think the mortality rate would be somewhere around 0.7 to 1.5%, which is still very high compared to seasonal flu.
Are you worried as a family doctor right now?
Yes, I am. But at the same time, I have great faith in science and medicine. I am, as you know, that the news. I think the number of people who are infected in the world is much higher. So far, coronavirus has shown that the death rate is almost 10 times, at least 10 times higher than regular seasonal flu. And I think that is concerning, and I think that's why most of the countries in the world, they want to delay the outbreak so that by then we will have some kind of good vaccine. And some antivirals are also being tested as we speak, and these antiviral drugs would act like antibiotics to kill the viruses. Believe it or not, we did not have any antiviral before this to kill coronavirus ever. We had some anti-flu drugs like Tamiflu, which was used quite effectively, but that antiviral does not work for coronavirus. And in the history, we were never able to make a vaccine for coronavirus. Some viruses, they jumped from another animals to our species, and our species is quite naive to these viruses, and that's the reason we suffer so much. But eventually, I think in our system, science, and the public health policies, especially in Canada, I think we should be able to get hold of this virus. I'm confident that before the summer is over. The thing is, going to the hospital and clinics would be tricky in the sense that there's a likelihood that you could have the virus, and if you go to public places like clinics and hospitals, there's a chance to spread it. But the other thing is that at the same time, we want to account for all coronavirus cases, so they should be tested. In my opinion, I think a person should be able to call 811 if they have mild symptoms, and the nursing staff, they would be able to guide them exactly what needs to be done. And I think a public health nurse who is fully covered from head to toe should come over and should be able to take a sample, a nasopharyngeal swab to test for it, especially if they have a mild symptomatology. If somebody thinks that they have this virus and they're quite seriously sick, then I think they should call ambulance. Why? Because the ambulance, the paramedics will take all universal precautions to isolate this patient and will take them to that part of the hospital which is reserved or isolated for COVID-19, and such patients should not walk into a busy emergency room. And so 811 for mild symptoms and 911 for serious symptoms. In today's news, there's one case which is a community-acquired infection. It means this person did not travel anywhere and did not come in contact with any person who had traveled to or come from high-risk countries. So there's at least one case in BC at present, which is community acquired, and I think that is also quite concerning. Once you start getting infection without coming in contact with anybody who has traveled to high-risk countries, then I think it means if there's one case, we think that there would be more, and such patients are not isolated and quarantined, and they can easily spread this to general population. I think keeping it undercover is correct, because the epidemiologist and public health, once they find out there's a case outbreak, I think they discreetly try to identify more patients in the same group, be it a school or a community or a church. And I think sometimes when these kind of informations are made public, I think there's unnecessary panic, and panic we think leads to wrong decision making and discrimination as well. And I think public health and epidemiology, we have to have faith in them. They're not disclosing these information for some nefarious purposes. I think they just want to do it correctly, because once panic gets struck in the general public, then it's very difficult to control, and there's a lot of uncertainty, and that leads to some decision makings which can be quite detrimental from public health point of view. Now, if you have cold or flu-like symptoms, wearing mask for you to stop the spread to other people is advisable. But if you don't have any illness, wearing a mask probably will not help you in any way. I think the mask and other protective gear should be left for the medical community, because they will be coming in contact with really high-risk patients. In fact, in South Korea, I was listening, the health minister is put a rationing on buying a mask, by the way. A particular family can only buy 2 masks per week, according to the news in South Korea. I don't think we have to panic yet, actually. The number of cases in Canada so far is 30, maybe 31 today. And the numbers will go up. We haven't had any death in Canada so far, fortunately, and I hope that remains the case. And some of these 30 patients, probably half of them probably are already on the road to recovery. And I think so far we have it under control in Canada.